The bottom line is that, they made decisions without data. It was
Yep.
based on vibes. But by sort of creating this thing where they've sort of created doubt around the safety or the role of the vaccine at that point in childhood, that just creates the mistrust that will result in fewer kids getting the vaccine. I mean, the bottom line is that, they made decisions without data. It was
Yep.
based on vibes. They used the
Based on
vibes
vibe.
that maybe right. The vibe is we don't want to give that many vaccines to kids when they're newborn, not based on any data that say that it's not okay, but just because the vibe is we probably don't want to do that. And that's not that's not how I'm familiar with sort of scientific and health policy being made. You need more than vibes.
Yeah, no, absolutely. And I think I was listening to a podcast the other day, and they were talking about the fact that one of the factors may have been that we've done such a great job of removing hepatitis B in newborns over such a period of time, is that people don't realize how bad it was and what a danger it
Yeah.
was. And they're like, well, it's not really a big deal because it never happens. And forgetting the fact that the reason it never happens is because of the vaccine,
Yeah.
and losing sight of that.
100%. I mean, like, listen, hepatitis B is a devastating infection to a young kid. Like, it's a devastating, if I'm 52 years old. I'm, by the way, vaccinated against hepatitis B. But if I weren't and I acquired hepatitis B, I have a 95% chance of clearing it on my own and then moving on. 5% chance of going on to chronic hepatitis B that can lead to liver cancer, liver scarring, and maybe a transplant or death in the future. Kids, it's the opposite. So the younger the kid, the stickier the virus is for them. So if you get exposed to the virus and get infected and you're a baby, 90% of them will go on to chronic disease. And then a quarter of those will go on to liver cancer or liver scarring and early death.
Right.
The calculus is easy, right? Like, the
Sure.
vaccine is like extremely, extremely well tolerated. It's being given at the time when the risk for the infection is frankly the highest. And history says that you can't test yourself out of hepatitis B. You can't just test every, parent. You could. In our system, we fail because our system's not a universal healthcare system, which, by the way, would solve so much. Um,
So much.
it's always the answer. But then,
Right.
always. But then ultimately, like, we know from the 90s and 80s that you can't test yourself out of it, that the vaccine is what took us from like tens of thousands of cases a year to like 2 dozen.